The Closers on KFRU and KLIK.
All right, well, thanks to David Lusky for sticking with us on that. Phone call was always an interesting thing. The cellular, I don't think anybody has a landline anymore unless you're working in a big office complex, and then everybody has a landline. Welcome back. It's the Closers here as we roll on. It's now time for our regular Thursday feature, especially during the football season. It is our Missouri Orthopedic Institute segment. Don't forget about their Saturday morning clinic. It is a free clinic over at Missouri Orthopedic Institute, and it begins at 9 o'clock in the morning and goes until 10 o'clock in the morning. So you got about an hour, but that doesn't take a long time. You get in, it's assessment, and then also referrals if needed. And joining me now, he's been on KFRU before, but joining me now on the Closers, Dr. Jay Bridgeman. He is a hand specialist, a hand microvascular limb reconstruction. That's a long title, but I'm sure it keeps you pretty busy. So
we're definitely very busy.
Yeah, I appreciate you taking the time. So
Thank
I really
you for having me.
do. Yeah, but the hand, the wrist, I mean, there are a lot of tiny little parts in there. It's
complicated.
It's the world's smallest jigsaw puzzle with 1,500 pieces.
You know, it's because it's so complicated that years ago in medicine we decided you have to have one doctor that can take care of everything that's wrong in the hand. You can't call a doctor for a skin problem and then another doctor for the bone and another doctor for the artery. So that's what hand surgery as a specialty was developed. So we can take care of all of those things. And even in the if you think about each finger, there's 3 bones in each finger. There's 8 bones in the wrist itself. The wrist is a ball and socket joint, but the ball is separated into 8 parts, which is really complicated. So I find it fascinating. We love the complexity. We love to take care of the Mizzou Tigers and all of the student athletes and other the Weekend Warriors that we see, and so it's really fun.
Do you do high school football on Friday nights?
I'm not a sports physician that covers teams.
Okay.
I'm what's considered a consulting physician.
Okay.
So all I do is really hand and upper extremity, like complicated injuries, sports injuries for that as well. And so I usually get called by the sports physician who's covering that Friday night team, and he'll say, "Hey, we had this really bad injury come in. Can you help us?" And that's kind of how I get involved.
Okay. All right. So you'd be on the other end of this, the free clinics on Saturday mornings that go from 9 to 10 o'clock. You'd be part of the referral process.
Yeah.
Dr. Jay Bridgeman with us here, hand specialist over at Missouri Orthopedic Institute. You just kind of briefly touched on the structure of the hand, but when you get a hand injury, and as a trauma specialist, are there times where you look at the injury and you go, "Yep, that looks bad, but we can fix that. You'll be just fine." And what are some of those type injuries?
Well, usually, even someone who's not a doctor will recognize deformity. They'll say like, "Oh yeah, that looked horrible," or "It doesn't look right," and so we need to get it splinted. So when we see injuries that the finger is completely deformed, you could even Google finger injuries in the NFL, and you'll see these guys have had finger deformities for years and still trying to manage to play and things like that. But those are the obvious injuries that we see. What's really difficult sometimes is that we've all had finger sprains or things we twist our wrists, a little bit sore, gets better. It's kind of the gray zone between those two injuries. Okay. And so I usually tell the trainers that I work with, people on the sidelines, hey, look, if someone's had something happen, it's painful, there's a lot of bruising, a lot of swelling. Even if it's something mild, it should be improving quickly. Okay. So if it's something where like it's 24, 48 hours and they're really in a lot of pain, that's usually warrants an evaluation. Oftentimes we'll evaluate it and say, hey, this is just a real bad one, but it doesn't need surgery. So it doesn't actually mean that they need a surgery. But I would use that as a rule. If people tend to have a lot of bruising, a lot of swelling and pain that's not improving rapidly, that needs an evaluation. We all want to avoid the situation where someone's had a fracture for 6 months and we're told, hey, you need to suck it up, dust yourself off, get back in the game, but they're still playing with a fracture. That's really difficult to fix. We will fix it, but it puts us in a harder starting position if we've kind of delayed the evaluation.
Okay, and then there are those moments where you look at it and you go, wow, that's bad, and then you have a chance to look at it and you go, yep, you're right, that's bad.
Yeah, well, we are a trauma center. Like that's what I love about working at the University of Missouri is that we're a level 1 trauma center. We're actually, a lot of people don't know this, but we're one of there are only 50 hospitals in the United States that have a designation for a hand trauma center, like a trauma center that has expertise in hand. And that's not true of other. We are the only one in our region in central Missouri that has that. The others that are in Missouri include in St. Louis, and there's one at KU in Kansas City, Wash U in St. Louis. But beyond that, you'd have to go to the University of Iowa. You'd have to go to Dallas. So for really severe injuries of the hand and upper extremity, we're it, and we love that. We love to be that resource for our community.
And are you it? On
no,
that level, or do you have a cohort in crime?
Yeah, I have a cohort, and we have several colleagues at the university in plastic surgery that also do hand surgery. And then I have a partner, Dr. Lalonde. He does hand surgery. I'm the division leader for hand and upper extremity, and I also was the leader of that project to get the certification for hand expertise. We really wanted that. And so we voluntarily entered this program where we had to be evaluated by other hospitals in the American College of Surgeons. And so we were able to prove that this is what we do day in and day out. And so we were able to get the certification. And so that's something I'm really proud of. Dr.
Jerry Bridgeman with us at Missouri Orthopedic Institute, and hands are the topic. And I mentioned the really bad ones. You think about in the farming community, incidents out on the farm, but even in sports, you'll get crush injuries, getting stepped on, or that type of thing. So, when you're looking at initial diagnosis, what's that process like for you on a severe trauma?
So it's not often that I've been on the field. As I said, I'm not a sports physician that's on the field for games, but usually I'm involved very quickly. Okay. I've also met people in the ER after the game. The sideline coach will say, "Hey, can we meet you in the ER?" I've met them there. And so what I'm looking for, to answer your question, is kind of where is their pain? Where is their swelling? We tend to think of trauma like an earthquake. Where's the epicenter? We really want to narrow it down. When we think about the hand, we can kind of think about it in quadrants. Is it towards the thumb? Is it towards the small finger? Is it on the palm side of the hand? Is it on the back side of the hand? Where's the bruising? Is there a wound? Early on, we would like to get an understanding of, is there any numbness or tingling? Did they injure a nerve? All the fingers should have good capillary refill, so that when that pink color, when you touch the tip of the finger, that should look normal. And that's mainly true for sports injuries. But then we're narrowing it down to, let's get radiographs. We want to know, is there a fracture or not? Are there any joints that look dislocated? As we said, some of them are so deformed it's obvious, well, the dislocation is there. And so, we can start narrowing down our treatment plan from that.
Okay. And now let's get into one. And having been taught skiing and been a skier for a long time. There's no mountains around here.
Sure.
But we used to call it skier's thumb. And you have your hand, and folks, just think about this. Take left and right hand and make like a fist. And you've got a pole there, and you're falling forward. And you let go of the pole, but because the strap or the way the pole's designed, your hand sticks out and your thumbs are out there. And they take the brunt of the fall. We used to call it skier's thumb, where the thumb takes the brunt, it pushes it all back.
Yeah,
we've seen that with Drew Lock taking a hit off the, falling down on the turf. Drew Brees hitting a helmet. So what's that process? That's the colloquial description.
We still use
thumb,
that. Yeah, we still use that term in medicine too. Skier's thumb. But, other people get it too. You don't have to be a skier, and I've seen it in even people who are kind of weekend warriors or just working out on their property. And it's exactly as you described it. The thumb should be stable next to the wrist. But when there's a force that pulls the thumb too far away from the palm, then an area that can often get injured is the ligaments that support the joint at the base of the thumb.
Okay.
So that you can kind of look at your own hand, if you're a listener, where the thumb kind of attaches to the web, that webbing area between the index and the thumb. That joint's called the metacarpal phalangeal joint, and it's the ligament on the inside. We call it the ulnar collateral ligament, not to get too complicated, but it's that ligament that's most at risk. It's also one that's really important for pinch and grasp. So if you get injured and it doesn't heal, every time you try to pinch and grasp, you're re-injuring that. It's painful. People will tell you, it's like, I couldn't return to lifting. I couldn't return to bicycling. I couldn't return to these activities because any grip activity is going to put pressure on a ligament that didn't heal very well. Most of the NFL players or an NBA player or an NCAA player, it's going to be obvious very quickly that they have a swollen thumb, it's bruised, and very early on they get evaluated in the training room to see if that ligament is stable or not, because you can test the ligament. It's usually painful, so until we get to that part of the exam, we may give them a little bit of numbing medicine with a shot, and then we get a real careful evaluation Usually that's done before an MRI. So a lot of parents will ask me, should we get an MRI? The MRI is helpful, but the exam is the gold standard. Like if we can get an exam, we can tell if that ligament's out or not.
How do you tell surgery or rest on that injury?
That's a good question. The research looking at the injury has found there's two patterns to the injury. There's one pattern in which the ligament is injured, but it's kind of a milder sprain, and the ligament is sitting where it should. And those are known to heal well without surgery. Okay. The more significant injuries, especially ones where they were kind of dislocated at the time of injury and then they kind of popped back into joint, that pattern of injury, oftentimes the ligament is not sitting where it should be, and that's where the MRI is helpful.
Okay.
The exam would tell us that the ligament is torn, but the MRI can give us that grade of injury, like how severe the injury is. And if it has that pattern to it that's abnormal, then those are ones that don't do well with the cast, and so they should be treated with a surgery. Some of my NCAA players will tell me, I know that mine can be treated in a cast. Mm-hmm. It's typically 6 weeks for a ligament like that to heal, but they want to get back on the court right away. They want to get back, I want to be back, doing my routines very quickly. And so some of those that may not definitely need a surgery, they still want the surgery because it's less immobilization. And we have newer techniques now at the university that allow people to get back to using their thumb at 2 weeks. And so before, kind of that judgment was, well, I can get this to heal without surgery. It's just 6 weeks in a cast. A lot of people are like, yeah, that's perfect. That's what I want. But we have some who are like, no, I don't want to wait 6 weeks. Mm-hmm. I want to get this going faster so I can get back. I don't want to miss this, section of the season. I've got other games that I want to be playing in.
Dr. Jerry Bridgeman, a hand specialist with the University of Missouri Orthopedic Institute, with us here on the closers. All right, so so we got that. What are some of those other common injuries that you would see that you're looking at? You've got to make that decision: cast and rest or surgery, and we can get you back. Are there some other ones along that line?
Yeah, there are. I mean, even certain fractures,
okay.
Depending on where the fracture is. Some of the fractures are in an area that we can really protect well with a cast, okay. And people can play. At the high school level, even at the NCAA level, they'll let you play with a cast, but it's got to be padded. Mm-hmm. I do, counsel the families about, returning to play with an injury that we've treated. And I tell them, look, if you want a treatment plan which there's no risk of re-injury, then that's clear. We shouldn't go back to playing. But a lot of the ones that I see, it's a low risk of re-injury, and it might be a high school senior. There's scouts that are, following him from week to week, and he doesn't want to take that time off. He really wants to play. And so we'll make a shared decision with the family about what we think is best. If the patient wants to go back to play and it's a low risk of re-injury, then we'll allow them to do that. But oftentimes, small fractures in the digit, those are common. Dislocations in the digit. A lot of dislocations are stable after they're reduced. Oftentimes the trainer will reduce it on the field. It doesn't come to the ER dislocated. It's already reduced. Many of those are very stable. And early motion is the key. We'll do buddy taping. So not every hand injury means I can't play. And so our philosophy at the Missouri Orthopedic Institute is, what can we do to keep the person in the game? What can we do to keep them at that high level? And that's true for the weekend warrior too. A lot of people, they really want to get back to activities. They don't want to wear a burdensome cast if they can get another treatment that allows them to be active. And
again, the sports injury clinic is Saturday mornings from 9 to 10 o'clock. That's where you can get at least the initial assessment, and then you get referred on. For parents with high school football coming up tomorrow night, and what are some of those things that they need to be watching for with the upper extremities, the hands, the wrist?
It's so interesting because some kids, we'd say in medicine, are very stoic. They don't complain. Or they know if they do complain, they may be taken out. And so it can be really difficult for parents to kind of ferret that out. Like, is this a real injury or is it just a sprain? But usually pain and swelling should be improving rapidly. Sure. We've all twisted our ankle. It gets swollen. We use the ACE wrap, some ice and things like that. But usually within a couple of days, it's feeling better. We're getting back to a little bit more activities. But if it's been a week and you're still having pain, the swelling's not better, it's worse. Patients can't make a fist. That's a common one. Like I used to make a fist. I can't make a fist. Mm-hmm. I would say within a week. We like to, if it's really bad, see it within 24 to 48 hours. But if it's at a week and they're not having significant improvement, that's a referral. They should be seen.
All right, that is Dr. Jay Bridgeman, hand specialist over at Missouri Orthopedic Institute. Again, the first place to start will be Saturday morning, 9 to 10 a.m. It's their sports injury clinic, and they do the assessment, and then they get the referral taken care of. And if you happen to see Dr. Dr. Jade Bridgeman. He'll get you up and running as quick as you possibly
Absolutely.
can. Doc, thank you. I appreciate the time and the information as well. So thank you.
Yeah, thanks for having me.
You can join the conversation anytime. Call 442-8255. The Closers on KFRU and KLIK.